Hello everyone, my name is Dr. Bukhari, and today our topic of discussion is a very common condition which we see in the hospital as well as outpatient, and is called pulmonary edema. So, the simplest definition of pulmonary edema is a flooding of air sac in the lung, which results in shortness of breath. It's simply the flooding of air sac in the lung. So, air sac in the lung filled with fluid. So, if you think about your lung, if you think about your lung, imagine that your lung is filled with lot of air balloons, and normally these air balloons stay dry. In these air balloons are called alveoli, where exchange of oxygen and carbon dioxide takes place. So normally what happen, the air goes into the lung and reach at the level of alveoli, and around these alveoli there are these capillaries where the blood is running. So when the air reach the alveoli, the exchange of oxygen and carbon dioxide takes place at the level of alveoli. But when these alveoli are filled with fluid, which is called pulmonary edema, this exchange will not happen, and that will result in hypoxia. Now, what is the mechanism by which this pulmonary edema develop? So, if you look at this image, so this is the alveoli, and this is the capillary which is running around the alveoli with normal hydrostatic pressure. But let's say if we increase the hydrostatic pressure in this capillary, the fluid will leak from the capillary into the alveoli, which results in pulmonary edema. So that's the first mechanism, increase hydrostatic pressure, which can happen in heart failure. The second mechanism is, this is the alveoli, and the hydrostatic pressure is normal, but there will be increased vascular permeability, so this capillary will become leaky. So this can happen in inflammation or in ARDS. So that also results in pulmonary edema. Now what happens when patient has fluid in the alveoli or pulmonary edema develop, that will result in decreased oxygen or hypoxia. So patient will have difficulty in breathing, which will create anxiety. Anxiety will result in increased catecholamine, which is increased epi and norepinephrine, which will result in vasoconstriction of the blood vessel, which will increase sympathetic tone. Increased vasoconstriction will result in increased load on the heart, and if the heart is already weak and patient has hypoxia, that will increase myocardial oxygen demand, which is putting the patient at increased risk of myocardial ischemia. So if the ischemia develop, patient will develop reduced cardiac output, which will result in increased end diastolic pressure, increased preload, which will further exacerbate pulmonary edema and hypoxia. When the heart is not pumping very well and heart has, let's say, decreased cardiac output, that will activate renin angiotensin aldosterone system, which will further increase sympathetic tone. So that will create a vicious circle with pulmonary edema. So there are mainly two types of pulmonary edema. One is cardiogenic pulmonary edema. So let's say when the heart is not pumping properly, the fluid will back up into the lung, which will result in increased hydrostatic pressure. Capillary hydrostatic pressure will increase. That will result in pulmonary edema. Because of chronic backflow of blood towards the lung, uh, it will also create increased size of right ventricle. Second is second type of pulmonary edema is non-cardiogenic pulmonary edema. So in which we have alveoli, but the capillary will become leaky. So that can happen in ARDS, it can happen in pneumonia, it can happen with toxic gases, inhalation of toxic gases. Sometimes it can happen with drowning. So these conditions can result in leaky capillaries and the fluid will seep into the alveoli, but the heart pressure will be normal in this situation. So this is called non-cardiogenic pulmonary edema, in which the capillary will become leaky. So how the patient with pulmonary edema presents like? So these patients will have shortness of breath or increase work of breathing. So they will often complain of drowning sensation from inside. They can have wheeze, crackles on physical exam. Sometimes they can have productive cough with pink frothy sputum. Because they have increased work of breathing, they have sense of anxiety. Um, they can have bluish discoloration of the lips or the fingertips. So these are the common presentation in patient with pulmonary edema. So when the patient with pulmonary edema comes to the hospital, and if you get the chest X-ray, how it look like? So pulmonary edema has different stages on the chest X-ray. So let's discuss these stages in detail one by one. So this first image on the right side, this is the normal chest X-ray with no edema. So you can see that the lung field appears normal. It's radiolucent. There is a fine vascular marking. You can see that the pulmonary vasculature here is coming down nicely, it tapers down nicely from the hilum. Cardiac size, if you see, cardiac size looks normal. There is no sign of fluid overload. There is no interstitial or alveolar opacities. So this is actually the normal chest X-ray with no pulmonary edema. Now, if we move to next stage, which is the severity level 1, there is some vascular congestion going on. So let me show you exactly what we are talking about here. So if you look at near the hilum, you can see some congestion of the pulmonary vessel here compared to the previous X-ray. So there is some congestion going on, especially in the upper lobe, uh, and you can see that mild cephalization is also happening here. So this is pulmonary congestion, but at this stage there is no interstitial or alveolar edema present at this point. You can also see that there is also some cardiomegaly going on. So it means that the left sided pressure is slightly elevated. So overall in this stage we can see that the blood volume in the pulmonary vessel is increased, but there is no actual fluid leak into the lung tissue yet. So this is what is going on in vascular congestion. So the pulmonary vessel is slightly congested, but no fluid actually leak into the lung tissue or into the alveoli. So next stage is stage of interstitial edema. So in this stage, if you look at the basal level, you can see some horizontal line which are called curly B lines. So these are the short horizontal line in the basal part of the lung mostly and caused by fluid in the interlobular septa. Curly B lines. Sometimes they are hard to see, but you have to see it very closely. They are mostly in the basal area of the lung. These are the horizontal line, which is caused by fluid in the interlobular septa. You can also see that uh, these are bronchi, but if you look at it closely, they are thickened from the outside. They just look like donut shape. They are thickened from outside, and donut like ring is present, or you can see a halo around the bronchi. So that is actually called peribronchial coughing. Peribronchial coughing. So peribronchial coughing is actually present in bronchitis, bronchiolitis, or in patient with pulmonary edema. So peribronchial coughing is basically the thickening of the airway. It looked like donut shaped airway, which is thickened from outside, or sometimes you see a halo around the airway. It is called peribronchial coughing. It is commonly present in bronchitis, bronchiolitis, and sometimes in pulmonary edema. So in the perihilar region, in this area, you can also see hazy reticular opacities. So it is starting to create a bat wing pattern. It is in the initial stages, which is beginning to form here. So reticular opacities, they are coming out from perihilar region. You can also see that at this stage, in the previous stage, when there is a pulmonary vascular congestion, the border of the pulmonary vessel was much more sharper. But in this stage, if you see that the border of the pulmonary vessel is not sharp anymore, and so there is a blurring of vessel border as a fluid accumulate in the interstitial space. So basically, at this stage, fluid leak out of the vessel into the interstitium, but it's not yet into the alveoli. So the vessel border is also not very sharp when you compare it from the previous stage. Now, if we move on to the next stage, which is the stage of alveolar edema. So if you look at the radiograph, it appears lot of alveolar opacities. You can see all the opacities, which means that the fluid is actually into the alveoli. You can also see air bronchogram. So you can see that this is some air present at this level, and around that there is actually a lot of fluid. This is air bronchogram, which is present on chest X-ray, which means that the air filled. Uh, it means that basically the air filled airway outlined by surrounding opaque lung tissue. So air filled airway outlined by surrounding opaque lung tissue. So usually this is present in consolidation. Sometimes patient with pneumonia, they can have air bronchogram. So sir, let's say there is airway and it is filled with fluid or pus or other material that will create, and then some airway is still passing. It's called air bronchogram. This can be present in pneumonia, CHF. It can be present in pulmonary hemorrhage also. So in this stage, which is the stage of pulmonary edema, which is present in the fluid in the alveoli, so there is a lot of fluid in the alveoli. So you will see cloud-like fluffy opacities indicating fluid inside the air spaces. So how the pulmonary edema is treated? So first you have to find out, is it cardiogenic pulmonary edema or is it non-cardiogenic pulmonary edema? If it is a cardiogenic pulmonary edema, you have to get rid of fluid and you can give them diuretic, which will remove extra fluid from the alveoli. If it is a non-cardiogenic pulmonary edema, then you will treat the underlying cause. So let's say ARD is caused by pneumonia, then you treat with antibiotic, and then definitely you start the treatment for ARDS also. Thank you very much. Have a nice day.